I'd like to introduce our keynote speaker, Dr. Meekum Williams, who is a senior lecturer in Aboriginal health and wellbeing at the Graduate School of Health. She has over 20 years' experience combining health, service delivery, research and education. Meekum's work occurs at the nexus of public health, criminal justice and Aboriginal health and wellbeing, and is focused on Aboriginal people's caregiving and health promotion strategies in the criminal justice system and post-prison release to promote healing and reduce risks of reincarnation, isolation and harm. Megan is a Wiradjuri descendant and has Anglo-Celtic heritage. She is a research partner for Living Our Ways study by the First Peoples Disability Network and Safe Spaces research by Men's Spaces Health Promotion Charity. So welcome Megan, whose keynote address is titled "We Wear Multiple Hats, Navigating Multiple Roles in Relation to Alcohol and Drugs Amongst Aboriginal People."
Thanks very much. Well, thank you, APSAD, for the opportunity to speak today, and to you, Kim, and also my colleague Michael Doyle, and my colleagues, including a young woman, Bianca, with whom I've yarned a lot about alcohol and drugs and our place in it lately. And I'd like to acknowledge the traditional owners of the land, the Kulin Nation, and their ancestors and descendants. And I acknowledge all Aboriginal and Torres Strait Islander people and our brothers and sisters from over the way in Aotearoa. And I acknowledge your efforts, your expertise, and your very important position in this place. So today I just want to share my experience, really. It's about looking back over the last couple of decades from research, service delivery, volunteering, activism, family and personal perspectives. And I really don't talk on behalf of others. My mob's Wiradjuri and I've spent time there. I'm very close to my country. And also I've spent a lot of time on the land of the Yuggera and the Turrbal people in Brisbane in particular. So this experience is mostly Murris and Kuris, and I apologise to you Noongars and others who I just look in awe at with the breadth of issues and experiences that we all have. And today I might not present anything new as such, but just try to draw points together in my own way. And many of you will wear multiple hats in relation to alcohol and drugs and caregiving and other actions on determinants of health, for example. So again, I acknowledge all of you with multiple hats. I'm not making this concept up by any means, but I think by bringing it out in the open, hopefully we can think about some other actions and solutions. So, who am I to even be here today? And how have I filtered the information that I'm presenting today? And who's given it to me? Which elders, family, colleagues, which research participants, and all of these people who are wearing multiple hats. How do they inform me and what I carry forward today? These are things that I very much think about and carry with me. I don't see myself here as an individual, but the people that have come before me and the people that come after me as well, always connected in that way. So firstly, I do know myself as having mixed heritage, which at times is very contradictory, and my families haven't, I've got 3 families and 2 haven't seen each other for my whole lifetime pretty much. But both families, my mother's ancestors are mainly English and have a very well documented history in the British Army, the Australian Army, as well as in health and library science. My mother's the first generation born here, and that generation's the one among whom poverty and tragedy struck. My father's side, the black side of the family, because I really am black and white, where my Wiradjuri ancestry is from. And Williams, Wiradjuri, there are many of us, and we're easy to place. But alcohol and drugs have been a powerful influence on both of my families across the last couple of decades. And there's been much loss and grief, and hidden grief on both sides. And for a long time, grief was the dominant lens of my own life. I went to school early due to family drama in a tiny bush town because there were no other options for what to do with me. I was in trouble with police young, and I was disgusted with myself. I kind of went into hiding and somehow managed to get to uni, where I did a student placement and I met people who were able to help change everything for me and with me, not just for me. I was treated at that little tiny service on the Gold Coast as if there was hope in the world, as if I had skills and creativity to offer and that everyone had a purpose. One boss I still think of as someone who really knew me, and he gave me that chance. And he wasn't an Aboriginal fella. I heard him describe himself as white trailer trash and white Anglo queer junkie. He'd experienced many of the losses of friends and family that we had, including loved ones in his life from HIV/AIDS. We shared a love of poetry and people tapping into their own stories and writing and writing and writing. He saw that I was unenthusiastic about the part of my job that meant I had to go to nightclubs on the Gold Coast with an 8-foot-tall condo man to hand out safe sex kits. He saw, however, that I could write about it, project plan it, and think about continuous quality improvement. Didn't include me. And he told me one day, "I have a surprise for you." I mean, whose boss tells them that? But also, we've never met as big a nerd as you. And he sent me on a 3-week full-time course in social research, in which I was one of the few English as a first language speakers and shared the time with people from all over the Pacific. Now, that style of research we learned was very suited to hidden populations where cultures were very different and important, and was driven by empowerment and capacity building. I felt normal, and I felt like I was found doing research like that. And very soon co-designed a multi-phase study among young injecting drug users in Brisbane, using peer researchers and pyramid selling to gather the data, and boy did that take off like wildfire. That drew a lot of the young people in to help interpret the data, and we held more workshops to develop resources to reflect the key safe injecting messages that they felt needed to be told. So that was in the early to mid-90s. And within only a few short years of that time, my boss passed away himself from HIV/AIDS and my co-researcher from an overdose. We've lost countless others along the way, and I'm astounded that I'm standing here to share this information. And I'd like to thank another boss of mine, however briefly that was for, and I think she might be here. She's a keynote speaker at about 1 o'clock tomorrow, Annie Madden. And she'll remember me as a uni student, probably a bit lost, but diligent enough, quiet and easily manipulated, including by the women from the Positive Injectors group who told me about their suicide pact. And I'm not sure if Annie will remember that work and full-on issue. And if she doesn't, that tells you about the enormity of what else she must have had to deal with in her career in alcohol and drug services. So fast forward from the 90s on the Gold Coast to the noughties in Brisbane, and I'd been working at a community organisation part-time with peer researchers, and that one was about remember NAROA, that phrase, NAROA, non-injecting routes of administration? That was the buzzword 15 years ago. And I was also working part-time, contributing to redesigning some courses at University of Queensland. And I'd finished postgrad coursework by that time in research. I'd deliberately trained in advanced stats and qualitative methods, evaluation and social impact assessment. And so I felt like I had a trade as a researcher. But I thought that I hadn't taken the academic path in that way, but I thought probably doing more research by PhD to run my own project would be helpful because I had little kids at that time. And they're now 14 and 16 and much bigger than me. But right at that time I was considering a PhD. My father rang me with just the most terrible news that my cousin, who was his first nephew and the eldest of us grandkids, had hung himself in prison. And it was one of the prisons I'd visited to do bloodborne virus education, so I knew the trees in the driveway and the location. It was just a low secure facility, and just a picture to go with the little story that I'm telling. This is Kelvin Anderson, who was the Commissioner for Corrective Services at a time, and that's at one of the centres where my cousin and others included had been terribly abused. And when I heard that news about my cousin, I just remember the shock and the disbelief and that bubble of time where everything slowed down. Nothing seemed important, yet everything seemed important. And I remember the distinct thought that I've got to put the pedal to the metal in terms of research and really carry forward Aboriginal people's voices in research because they weren't heard. And I really was astounded that somebody could die in state care, that somebody could die. And I was somebody who had the whole Royal Commission recommendations on my bookcase at the time, but I never would have thought it would have happened that close in our own family. And I remember the handing down of those recommendations. I remember the handing down of the recommendations of the Bringing Them Home report clearly. Those are the types of days that are what I measure my growing from, and that is just profound and disgusting in a way that those are parts of our, rites of passage when these recommendations are handed down. Those are moments where I stop deliberately. And we've got another one of those coming up this Friday when the Royal Commission into Protection and Detention of Children in the Northern Territory will be handed down. The Sydney Morning Herald saying on Friday, this will be a national moment of reckon. But gee, I hope reckoning includes meeting responsibilities, accountability and reform, because it hasn't yet to date. My cousin's death in custody got me thinking a lot about project options, and I decided to join colleagues who were beginning a large quantitative project on drug and alcohol issues, including mortality in prison and post-release. To get through ethics review at the university, they needed Aboriginal colleagues and they needed to do some qualitative interviews with Aboriginal people. It seemed a bit tokenistic, but it seemed a way of getting access or being part of a really large study. I naively hoped for the best. I did swear at one of them a lot about not letting Aboriginal organisations help shape the project in order to improve follow-up rates. Along some of these lines, our loss to follow-up will just be the same as other studies, and we can explain away why it is so low along the lines that others do. And I say, but surely we're not other people, and we know exactly how to make big improvements if only UF&Cs would listen. We often know how to find Aboriginal people in the community. Pretty much everyone's connected, and we can use that family network to follow them up, especially through the elders. But the project is already designed, I was told, and funded, and it's funded by taxpayer money. Are you asking me to lie to taxpayers and just go and spend their money, God knows how, to see if it will work? And I say, but you said you designed the project to meet the NHMRC's ethical guidelines for Aboriginal and Torres Strait Islander research. Reciprocity, respect. You signed on the dotted line to say that. Well, I'm giving something back, this one says, by allowing you access to the data. But I say, but the data belongs to the participants, it doesn't belong to you. The participants are de-identified, they won't know anything more. But Aboriginal health research is supposed to be community controlled. But this is not Aboriginal health research. You people just happen to be overrepresented in the data, and we have to do things differently to accommodate you. Well, leave Aboriginal people out of the data then. But that'll bias the data. But you're biasing the data anyway by not asking the right questions of the mob in the right way or following them up in ways that we know how. Well, you're confusing your role as a researcher with your family issues. And if you want to help, why don't you go and get a social work degree? That was a very influential moment. We're still in touch, and I've got a lot of respect for the particular researcher because we did talk through a lot of that. So don't worry about that, and I don't mean to be disparaging in any way. And I am stats trained, so that's not the issue either. But I'm just more trying to illustrate through example, just so many of the complexities, what we face within ourselves as well as within the academy. But for me, the best protection is being around other Aboriginal and Torres Strait Islander people. And back then, I had a project with a community justice group and was on a working group about deaths in custody, as well as a policy campaign group called Project 10%, which was calling for a new Aboriginal and Torres Strait Islander justice agreement in Queensland. And it was so named because if we reduced prison rates by 10% a year for 10 years, doesn't sound very much, not a very high bar, then we would even out Aboriginal rates with others. And I was encouraged by the senior women that I was hanging out with then to just plan a qualitative study and see where it would lead. So that became a multi-phase grounded theory study in which I undertook a process of caddy iteration, fracturing the data and restructuring it. And the core concept that I ended up researching in this, not me, the data says that, was about connection and connective action, and those people with multiple roles being really instrumental connectors. So alongside research, providing feedback has been really important, and we call that now research translation, and it's a bit of a buzzword, but if you read those NHMRC guidelines, it's our responsibility to have end users of the research actually design the research in the first place and to participate together. So I just wanted to urge all of you to have a look for this if you haven't already. If you go to the croaky.org website, it's a social journalism for health project where we published 90 articles from 70 participants all around the country about the leadership of Aboriginal and Torres Strait Islander people within criminal justice system, and with a focus often on drugs and alcohol. And so here's the book. I've got one copy available if anyone would like it. But otherwise, the whole book's there to download and clog up your email box when you send it out to other people. And so that's an example, I guess, of that research translation, but also it's an ongoing process, even though it was a fairly defined time frame. And we'll continue to publish articles. And part of that work also was brought about because of my training through the Lowitja Institute, which I've been involved with for over 10 years, and I'm really indebted to Auntie Pat Anderson and Auntie Lowitja O'Donoghue, as well as the Lowitja board and staff, for lots of opportunities in the past and a real sense of belonging among other Aboriginal health researchers. But before I share any insights from the research about wearing multiple hats, or just talk on any other number of things, because I can talk for kind of semester's worth, you've gotten to know a bit about the micro-me, a little bit of the policy context that I worked in Queensland, but now I just wanted to reflect on the bigger context that really this is where our answers lie. And I just really want to take a moment to read something from some people who all wear multiple hats in their families and communities, in their organisations, as well as internationally. And alcohol and drugs are not sectioned out and separated by these people. Alcohol and drugs are seen as a symptom of oppression, of disempowerment, and the subtle differences between those at individual and at community levels. So what I'm about to read you underscores many of our efforts in conducting research and in delivering effective programs and culturally appropriate programs. So listen here for all the instructions about how we all can be culturally appropriate. This is what our leaders are currently saying. Our Aboriginal and Torres Strait Islander tribes were the first sovereign nations of the Australian continent and its adjacent islands, and possessed it under our own laws and customs. This our ancestors did, according to the reckoning of our culture from the creation, according to the common law from time immemorial, and according to science more than 60,000 years ago. Lots of hints in there about Aboriginal people. This sovereignty is a spiritual notion, the ancestral tie between the land, or Mother Nature, and the Aboriginal and Torres Strait Islander peoples who were born therefrom, remain attached thereto, and must one day return thither to be united with our ancestors. This link is the basis of our ownership of the soil, or better, of sovereignty. It has never been ceded or extinguished and coexists with the Crown. Who could think it otherwise? That peoples possessed a land for 60 millennia and this sacred link disappears from world history in almost just 200 years? With substantive constitutional change and structural reform, we believe this ancient sovereignty can shine through as a fuller expression of Australia's nationhood. Proportionally, we are the most incarcerated people on the planet. We are not an innately criminal people. Our children are alienated from their families at unprecedented rates. This cannot be because we have no love for them. And our youth languish in detention centres in obscene numbers. They should be our hope for the future. These dimensions of our crisis tell plainly the structural nature of our problem. This is the torment of our powerlessness. We seek constitutional reforms to empower our people and take a rightful place in our country. When we have power over our destiny, our children will flourish. They will walk in two worlds and their culture will be a gift to their country. We call for the establishment of a First Nations voice enshrined in the Constitution. Makarrata is the culmination of our agenda, the coming together after a struggle. It captures our aspirations for a fair and truthful relationship with the people of Australia and for a better future for our children based on justice and self-determination. We seek a Makarrata Commission to supervise a process of agreement making between governments and First Nations people and truth-telling about our history. In 1967, we were counted. In 2017, we seek to be heard. We leave base camp and start our track across this country, and we invite you to walk with us in a movement of the Australian people for a better future. So, I didn't write that. I wish I did. Well, not really. That's the Uluru Statement. And for those of you who didn't realise, that's what I was reading. It was written by a 28-member working group elected at the Uluru Convention, First Nations Constitutional Convention, convened by the bipartisan group, cross-government, appointed referendum council, co-chaired by a non-Indigenous lawyer and Mark Liebler and Lowitja Institute, Auntie Pat Anderson. I didn't name it up front because I didn't want you to hear it for the political football that it seems to have been, but for what the words actually said. The statement is named as unashamedly being from the heart, and that connects the very real experience of Aboriginal and Torres Strait Islander people as individuals with a heart, as people who care, as well as being professionals and leaders and Australian citizens with a view for the rest of this country, not just for our mob, and these roles are never separated out. But at uni, studying a human services major, I had to compulsorily take courses in organisational studies. We had assignment after assignment about how to ensure that we could understand and separate out our personal, professional and organisational dimensions of a frame of reference, a la Irving Goffman and American organisational psychology and also British social work. I thought then that it was crap and not possible, but we were told absolutely that you should not wear your heart on your sleeve, that you should not express a personal opinion, that you should be the professional. You need to be in the position where you are confident leading a client through a process, assuming an expert position in relation to issues, and that will help the person who has come through the door. Of course, this does sound a bit paternalistic nowadays, and nowadays we've got a whole heap of other client-centred care language, but I work in tertiary education, training health, the future of our healthcare workers across medicine and allied health. And what I see reinforces the divide between the personal, the professional and the organisational. Add to that people and students are terrified of saying the wrong thing to Aboriginal people. And they're terrified of us being quiet clients in the little waiting room or in the client consultation room. And there's the sense that we'll be hostile if we're not talking, or that we'll be mute, and that we'll certainly be non-compliant. But I just don't see Aboriginal people that way at all, because when things are done well, there can be better successes that we can all learn from. Aboriginal and Torres Strait Islander community-controlled health organisations, for example, can show they have better reach, better follow-up care, better rates of things like immunisation than government programs can manage. True story that, and it's documented. But going back to that grounded theory study, which I call Baraminya, which means to recover a sense of oneself in Wiradjuri language. The study started with 12 interviews, just 12, not very many, but in depth and like a huge amount of interview transcripts. All of those stories were used in an intervention package and also went to about 1,500 people in prisons, and also informed the next round of the data collection there. The second round of data collection was, again, just 12, but a lot of material, and they were theoretically sampled so that we could ask about, among Aboriginal service providers, what do you do to help reduce risks of reincarceration, particularly around alcohol and drugs? That then led to some really interesting findings. Even though these Aboriginal people were in what we call professional roles, they often had those multiple roles of being a program provider, a committee member, an advisory body member, and none of that was sought through sampling. We weren't asked, we weren't asking about these other roles that people played in the community. They also had other relationships to prison issues like either being in prison themselves or a family member of someone in prison. And this insight in true grounded theory way led to another round of 12 interviews that were collected to specifically explore the mixed roles that the interviewees had. And this revealed all the benefits, complexities, self-care issues, ethical practices, and opportunities for program design, both to reduce risk for reincarceration, but also harmful alcohol and drug use. And these interviewees had done advocacy work informally for people. They'd volunteered in various ways. They'd taken care of prisoners' children at some stage. Everyone's personal and professional lives were touched by grog, pills, dependence of all types, sickness, the need for healing, and the need for healing journeys together with other Aboriginal and Torres Strait Islander people. And at the same time as doing this study and being involved with Project 10%, I was involved with the Mad Bastards Be the Best You Can Be program with Mibinbar. That's where I earned the nickname Meg Bastard. And I'll tell you briefly about this too, because being a researcher and being in the community and a community member and an activist all help deepen the insights from the research. And so all of us, again, I say, had mixed roles, and we all had done actions across each of these levels. We were working at that individual level. We were running programs and services. Project 10% deliberately ran forums and a survey among Aboriginal people to get input into the design of a new justice policy in Queensland, and we very much reflect this multi-layered ecological model of health. But what we saw missing was anything about history in many of these diagrams, and also country or the environment rarely added onto these ecological models. So a little bit later in my work life, I was involved with a team with the Healing Foundation, and we developed this other ecological model that was embedded in a program logic, which I want to show you because I just can't help myself, but definitely look up this resource. It just has so many answers, I guess, to the problems and the complexities, but also solutions. And this diagram also signifies that Aboriginal and Torres Strait Islander people have got all the solutions well identified, and that you don't need to come up with them, and really neither do I. And what we do need to wrestle with is how to create stronger relationships with Aboriginal and Torres Strait Islander people and develop the partnerships through which we work. So yeah, I'm not going to read through any of the values, the resources, foundational activities, and all the outcomes that Aboriginal and Torres Strait Islander people see come from collective healing processes. More for you to read about a little bit later. But here's a picture signifying how I ended up seeing frames of reference, not the personal, professional and organisational from the overseas theory, but something a little bit more like this, where we have formal roles and informal roles, and within these, people both give and receive support, and that's okay, even within a formal health program context. And the overlapping area I kind of take to signify, and this word intermediary comes to mind, and people have an intermediary role that connects people to formal support as well as other informal support. And it's that role as the connector that's just so vital, but that we don't do anything about to care for. So that connector can also mean can be really long continuity of care that occurs, and that often happens because Aboriginal people are often known to each other. You know when someone's entered rehab or entered prison, you know the family, you know who to talk to, who to follow up, when to follow up, how to follow up, and it's that knowing as the connector that we ought to bolster rather than be afraid of. But as soon as we're afraid of it, we won't ask the questions about how to bolster it and how to mitigate any risks that go along with it. And we'll talk a little bit more about that in the end. But that connector, it also means multiple types of support can be provided as well, because that connector, like you can use active network theory within this too, that connector can do really quick assessments of what people need and how and where to connect them, and all those different types of support that can occur through connections. So this fella, Karilpa, he talked about how his experience of the disconnection from himself was a disconnection from culture, and the place he went to connect with professionals and elders taught him about his spirituality, and that helped him understand his culture, which then helped him to access like education pathways, qualifications, getting legal support, custody of his own children, and then he's a role model and supports other people as well. So that's not actually very new, I know, in the alcohol and drug field. We've used peer support workers, you know, for a long, long time. But in, say, Aboriginal health, it's not really that new either, but in our approaches to funding Aboriginal health programs, it's extremely rare for us to bolster the support of caregivers particularly. So I'm just going to show you a couple of other things. This I'm sure many of you have seen time and time again, but I was really hoping, I know it's 3-something in the afternoon, to try and see it afresh. And I'm going to read through it. This is the Aboriginal definition of health, that it's not just the physical well-being of an individual, it's the social well-being, emotional well-being and cultural well-being of the whole community, in which each individual is able to achieve their full potential, thereby bringing about the total well-being of their community. And it's a whole of life view. It includes the cyclical concept of life, death, life, you know, in which we've got the responsibility to pass on things to the next generation. So to us, this is the actual planning tool for programs. This is the place to start. This is an audit tool as well to see that you're on track. We don't need to go looking too much further afield. This has been around since 1989, and it's about all of us really becoming comfortable. We see how it matches to that ecological model of health and multi-level empowerment framework. So in terms of worrying about being culturally appropriate, it's time to start looking for the similarities and the things that we've already got at our fingertips to help us understand and identify the overlaps and the similarities to go together. So I know I've bombarded you with information and I've got kind of like plenty more, but I just wanted to start to boil down into my favourite 15 things for transformation, which probably could have been a list of 10, but I like to sort of keep things specific so that we keep them on the agenda. So just to overlap, point 1 is to work with that ecological multi-level model of health. Point 2 is the collective healing. Point 3 is, I didn't really point out, but this is also a lot about transdisciplinarity, that connector, that Aboriginal person who can connect and work across the emotional, instrumental, practical, all those types of support. That's someone working across disciplines. I mean, they can navigate the legal system just as well as they could run a little, healing circle with women in a really deep way. So people are multi-skilled out there among the mob. But point 3 is getting better at transdisciplinarity, because we use that term a lot, but we actually don't do any activities. And I've had a project fall apart recently where I was working with an artist and with a social scientist, and I see myself as from public health, and we had very different understandings of how things were to happen. So point 4 is using that. And then point 5 is a little bit different. It's about all of you being able to make a strong introduction to yourself, because this is a cultural protocol. It's foundational. Knowing how to portray yourself is the basis upon which we then relate to other people. Knowing how to portray yourself and introduce yourself shows you've got a trust and a knowing for yourself, therefore that you're trustworthy. And it does improve your confidence. So you need to give it a bit of practice if you haven't, not already au fait. But this isn't just about saying who you are and what your job is, but more like, who are you? A little bit of what makes you tick. What are your values, so we can start to trust each other? And where are you from? What's your relationship to Aboriginal Australia? Like, seriously, think about that relationship. Not just to Aboriginal people. When I've done this countless times, you just hear people say, I don't know any Aboriginal people, I don't have any Aboriginal friends. But that's different to your relationship with Aboriginal Australia. What we just heard about in terms of constitutional recognition and potentially all of you voting for our future about that. Like, really, what do you know? But how do you carve out the time to find, out those answers? That's the hard actual challenge, is creating that space instead. So my point number 7 is about, developing the relationships with Aboriginal and Torres Strait Islander people. And point 8, I'd say, is kind of about stepping out of the way, except to facilitate processes where Aboriginal and Torres Strait Islander people can set priorities themselves. And what we do, I'll include myself in that because I can't set priorities for services or communities. We then identify in us what resources and tools we've got to share along the way. The Mad Bastards program uses the film about an Aboriginal fellow who gets out of prison in Perth, and he travels up to the Kimberley to find his son who's out on Aboriginal boot camp. And there's all kinds of falling apart and regenerating and transformation. We use that in a facilitated process with all different kinds of men's groups across the country. And in the end, what it does is helps local people identify the priorities and who's going to do what. So just to say, there are tools out there to use in priority setting, and you can read about Mad Bastards in the Just Justice book. So point 9, and I know this is getting to be a long list, but it's to stimulate you to work from the critical success factors that Aboriginal and Torres Strait Islander people have already identified, and through research as well, in this case, a cross-case analysis of about 7 Aboriginal and Torres Strait Islander youth programs considered effective by local people. hence going through a case study and cross-case analysis process. So I'm not going to read through all of this, but to say the findings are all documented about how do we move from just surviving to being an effective program but not growing, to growing effectively, let alone flourishing and reaching your full potential, like as a service as well as an individual person. We use the case studies to map that process, and then developed this set of critical success factors which still transform, and they're currently being retweaked for one particular service. More just to also flash up on the screen. There's a lot of solutions already identified, and that takes into account how to work from strengths and how to work from Aboriginal ways of being and doing, finding funding that supports that, and then supporting mechanisms to carry that message to others. So that was my point 10, and point 11 is about better assessment tools. I mean, it's just a shocker. Project I work with UNSW and Ted Knopf's foundation, nothing to do with that project at all, but 30% of those, the young people at that residential rehab are Aboriginal and Torres Strait Islander. And there are a number of features of the program that are about, cultural stuff, but the assessment tools kind of have nothing to do with that, and we can't really pick up what's going on for the individual young person. We can't ask the questions about what types of intermediary supports do they draw on. What type of support are they to another person that's part of your identity and your wellbeing? But we do have this growth and empowerment measure, and there's quite a bit of literature. I think there's 45 odd articles about it in about the related program, the Family Wellbeing Program. Family Wellbeing Program participants, that has a 25-year history in itself, developed core concepts in growth and empowerment, and that was turned into this measure, which has been through psychometric validation. And so again, there's several publications, and I won't talk about this today, but there's scenarios within it, and there's multiple ways that it can be used among young people, older people. Bits of it can be used. So my point 11 is, point 11 relates to that, which is to really understand the population that you're working with, or me as well, not pointing the finger. We can see here a very quick snippet of the population pyramid is that about half our mob are under 25. So we have to focus on prevention in the future. So part of that is about better research translation, and that's where I'll park family wellbeing, because it is a program that's been researched. Why is it not more available right around the country, in prisons, in the community, as a way of doing staff training for non-Indigenous people? It has amazing potential. So point 14 is about cultural respect, and me having a framework to make sure we make progress in our lives, that we don't stay stuck, we don't become dead wood and burnt out, but that we have a way of critically reflecting on our own practice, not just pointing the finger at clients that they have to do journaling, for example, but that we have that our own framework. And then finally, my last point is about, I guess, just that reflection on ensuring that research findings from Aboriginal people are taken up. There's all these challenges. Aboriginal people are often seen as sick and can't be trusted, and that that we bias things by our own subjectivity, that we don't have evidence so we can't make decisions, and that we don't want a black armband view, and that human rights is for some reason a political issue. But we do really ask that we enact our citizenry actions, not just at that individual level work, but that we become comfortable with that ecological model, and that we are positioned as activists, whether we like it or not, because if we don't really push for system change, we are all complicit in this cycle going around and around. So I just wanted to end with a moment's silence to think of Friday and the feelings that the families and the young people are going to have when they see their business in the newspapers again, and maybe the disgusting feelings in the pit of our stomachs that we might have about whether any of those recommendations might ever see the light of day, because we don't have a good record to go on. But without hope, we are hopeless. So let's take a moment just to think, conjure a little bit of hope for the way forward. I hope we do find that hope, and I know I've rushed through and come to a few semesters worth of courses, but also thank you so much for the opportunity to share these reflections, and thanks for listening.
I think we started a couple of minutes early, so there's probably time for one or two questions if there is any from the audience.